Do you want me to have the speaker?
The speaker.
Or the, oh. I didn't know we were recording.
Good morning, everybody. It's Dr. Nick here at Kalkstein Chiropractic. We're here with not Kendra, but with Jayla. She's hiding in the corner here. Jayla's been having some right lower back pain. Started when?
Probably like 2 days ago.
A couple days ago. Okay. She had been examined, at least by Dr. Angie yesterday. Dr. Angie had noted that her right SI is a little stiff, restricted. She gets some pain and discomfort with right hip flexion, bringing that up. And in response to that, the erectors of her lumbar spine are also very spastic and tight right now. And we just found out here recently that her Soaz muscle is also very tight. So she gets the pleasure of getting some Soaz ART, which is why I have Kendra here. Kendra's gonna help me out with this. And we're gonna get Jayla feeling better. So pop up here, lay on your side. Yep, facing the wall. The longer I work here, the less I'm confident in directions, which is a crazy thing to say.
Yay.
This is Jayla's by far her favorite treatment within the office, right?
Yeah. It's so fun.
We'll do, give me 3 passes.
Okay.
Wait, hold up. Let's bring it up just a little bit higher. Breath in. Let it out. Good. Go ahead. It's not too much, is it?
No, this
Tolerable,
one's okay. This is tolerable.
Strong. Okay. Bring it back up.
It definitely feels like a stretch.
A little bit more pressure on this one. Go ahead.
That one's definitely not fun.
I will give you props, so you're not tensing up, which is a very hard thing to do, especially when you're in pain and someone's jamming their whole hand into your side.
Yeah.
She's staying relaxed, which is...
It feels like you're touching my back.
Probably is.
Good, last one. A little bit distal here, right over the tendon.
Oh, gosh.
Good. And on this one, Kendra, keep in that position. Take your right hand over your head. Big breath in. As you let it out, Kendra, pull that leg back a little farther. Good. How fun was that?
So fun.
Great. Awesome.
That felt like
Thank
a
you,
massage,
Kendra.
basically. It felt like I was on the beach with getting a massage. It was so good. In the clouds, of course.
With the Mai Tai in your hand.
Yeah.
All right. So what we're gonna do today, depending on how much time we have, we're definitely gonna adjust.
Okay.
If she's up for it, she responds pretty well with needles, and we'll see how you do.
Can do that.
Cool.
Go
Let
to
this right knee bend up.
Okay.
Give yourself a hug.
Yep.
Let that hip roll towards me. Good. Very nice. Other side.
Ugh.
I'm gonna change hands. There you go. Good. Let that shoulder just open up. There you go. Very nice. On your back. Little pull.
Okay.
Let the leg wiggle. I think this is the first time I've ever adjusted your lower back.
Yeah, I usually
Everything
don't.
has been mid back and neck.
Yeah,
Let
I
that
don't.
foot relax. There you go.
It's hard for me to relax my ankles because they feel like they're gonna kind of fall apart with that one.
All right, you can go ahead and step off.
I feel a little looser.
Good.
That's nice.
So Jayla's keeping it pretty easy for us. What we're gonna do now is we're gonna jump over to dry needles, get her poked up, and then we'll touch base with her afterwards and see how she's feeling. We'll see you in the next bit, guys.
I
guess if you want to talk, then yeah, we can put it down in there.
ASMR.
But it might sound muffled.
I moved it, so.
Got a lot to yap about.
I don't know. I might.
Okay. What's the topic of yapping today?
What should we talk about, Carly? We should talk about our food order today. So,
I don't know what they have yet.
I think that because we did have Mexican last week, which was so good, Mexican ramen was delicious, we should skip Chipotle and get sweet green instead.
I thought we were doing that.
Yes, I told Warren this, and Warren listened, so that was amazing
She's
for
just
me.
reenacting her conversation this morning. She's very proud of it.
Yes, because it worked. My plan worked.
Your evil plan.
Yeah, I don't know if everyone... Well, Carly, you don't like sweet green. Nick, do you like sweet green?
No, I've just never had it.
Not terribly. I'm not a salad guy. Used to be. Not much anymore.
That kind of
They
hurts.
have more than salad, right?
Yeah, they have like quinoa.
No.
Wonderful.
No.
They have
All right,
rice.
you guys. We're back. Better than ever. We're so back. But we're with Jayla again, and we're going to dry needle her right side lumbar erectors. We're going to get a little bit of her QL, and maybe get some around her SI joint, depending on how well she tolerates the ones before. So, finding her 12th rib right now, because that's important. So we'll go through a little bit of our erectors, hit some of the multifidi through this region. You'll be able to tackle the world after this.
Yeah, I love dry needling, so I believe you.
Who is DJing?
Yeah, I
who
was
is
really,
DJing
I
today?
almost sang, but then I forgot I had the microphone right here.
This Orioles are playing so well right now.
I think they're getting the aux revoked.
Yeah, as long as, well, no, anything's better than yesterday. Yesterday was like slow R&B.
That would be Warren.
I was like a walking zombie.
Dr. Warren, and I quote, says, "I want some funky music."
Well,
And that's usually what
there's
happens.
difference between upbeat funky and
No, he likes like soulful funky music. So like it ends up being slow.
oh man, time and place for it. Not here. How you doing with these?
I'm doing good.
Cool.
Chilling.
I got just a couple more for you.
Okay.
That's a fun one. Last one. All right. Cool with those?
Beautiful. Yep.
Sweet. We're gonna let her cook for about 10 minutes, and then we'll come take them out, and she'll be brand new.
Yay.
Guys, if you have any questions about SI joint pain, or really any low back pain, leave the questions in the comments below. Happy to answer them. Otherwise, we'll see you in the next one.
Yes, like and subscribe, comment, repost, do all the things because you are getting this lovely angle of my face.